got Amir here this morning to talk about all sorts of things and the latest on COVID. But are you an advocate of a builder?
As well.
Oh, there you go.
There you go. Wine.
Is this good news? Because often we know about fancy teas being good for you, don't we? Sort of herbal teas, things like that. But actually, a strong builder's brew is good for the heart and good for blood pressure.
Yes, morning. There's flavonoids in tea, and it's in cocoa, it's in apples, it's in berries, and in red wine, as you said there. And what they can do is open up the blood vessels a little bit, so they're a bit wider. The pressure drops that way. It relieves the pressure on your heart, so it drops your blood pressure and can help as part of a well-balanced lifestyle as well.
So we keep on drinking our tea because we're going to need it to keep our blood pressure down, because there is more concern over the numbers of coronavirus cases. Yesterday was a high, wasn't it, since records began, and very worrying. Although some positive news on the front page of The Times, which shows that the message has been getting through to young people. They've often been blamed, haven't they, as spreading the virus, although mercifully less at risk of catching it. But actually, in areas where the numbers are decreasing, like the northeast, they're saying that the worried young, the concerned young that are following the restrictions are doing a great job.
Yes, it's nice to hear that, actually, because they have been blamed, which hasn't been fair. Numbers are dropping in younger people. They're listening to the social messaging that is going out there. There's also concern that they were really worried about long-term COVID. And there's been a study by King's College London that's come out recently suggesting 1 in 20 people who get coronavirus suffer from symptoms for over 8 weeks. So it's good that this is dropping in younger people. It's really, really important. But we are seeing it spread into the older age groups at the same time. So we've got to be careful and adhere to the rules.
And when we look at the hospitalisations, the death figures that we're looking at the moment, does this give you some reassurance, or do you fear that, you know, they talk about the numbers being baked in already, don't they, by the fact that we're going to be seeing them go up for some time because of the situation we're in? I mean, you'd like to think that knowing a bit more about the virus, treatments have got better, but are we going to see things get a lot worse before they get better?
Well, there's always a lag, you know, with the number of cases that are being reported, and then what happens in hospital, and then sadly the deaths. There are reports. A Sage scientist has said that the northeast, the northwest numbers, if things aren't done even more than tier 3, if things aren't put in place, that numbers may go up, and we could see a peak in about 4 to 6 weeks here, and then in other parts of the country over Christmas and New Year's. So it's always worth reiterating the message around hand washing, social distancing, and mask wearing, because that is the best thing that we have. But yes, we do have treatment options in hospitals when people get sick. Steroids are now being used because we know they work, and we didn't know that at the start of the pandemic. So we do know more about the virus and treatment options available.
You mentioned older people and the worrying numbers there. There's a suggestion today that there should be restrictions on the staff moving from care home to care home. So one of the concerns is because, you know, the system is that on both sides, for those who work in care homes, they're very often on 0-hour contracts. So therefore, working over several different sites makes up their salary. And also from the side of the care homes, there's a great reliance, isn't there, on people coming from agencies or bank staff to work in care homes. So what do you think of this idea? Because it seems sensible medically. It seems sensible from what we know about the pandemic, that restricting movement is good. But on the other hand, can the system cope with that?
Well, we've been worried about care home people for a long time. We know if coronavirus gets into care homes, it can devastate them. And I've experienced that in the care homes that I've looked after, and I've spoken to relatives, sadly, of people who've died, and it's been really, really tough. Now the evidence suggests that the virus is being brought in by carers, and you can understand why that is. It is a low-paid job. There's no getting away from that. So if you are an agency worker, you often do have to spread yourself around and do other jobs in other care homes as well. And it is a really hard job, and it involves a lot of contact. I used to work in care homes all through the summers while I was at medical school. I know how close you get to these people, the care that you have to provide for them. It's really hard. It's really tough. Officials from the care homes associations have said that this could actually lead to care homes closing if they can't find staff to care for the residents there. So it's a double-edged sword. It's a difficult one to get right. But these people, yes, they need the care. They need the people coming in to care for them. If they don't get that, that could make them sick as well. So we've got to get the balance right. It's a really tough one.
You mentioned earlier the importance of messaging. Something in the papers today on the front page of the Mail, actually, is talking about this police chief. It's the officer leading the national police response to the pandemic. He said, even I don't know the rules. There seems to be a real issue about confusion about the tiers, what is and what isn't allowed. And this is Owen Weatherall. He told MPs that the three-tier system that we're in was too confusing, that people didn't understand it. There was some issue about when households can mix. I mean, there's a bit of a worry here, isn't there, if the police officer who's in charge of the response to it doesn't understand the rules himself. How's the rest of the country supposed to keep track of what they're supposed to be doing and where?
Yeah, I think this is what makes it very, very difficult. I get calls from patients, from families, from friends almost every day saying, am I allowed to do this? Does this fit with the rules? And I think it reflects the differencing between rules across the country, England, Scotland, Wales, and within those areas as well. You understand why those rules are there. They've tried to make it easier with the tier system. I'm not sure that's worked because people are constantly having to look that up. I think it's important people in charge and people who are responsible get the messaging right and make it really clear for people to follow. It is difficult, let's be honest. Even I have to look it up sometimes.
Yeah, it's when you get into the detail, isn't it? It's when you get into the fine detail.